Dear all, thank you very much for being here this evening. My name is Isabelle Fabbricotti. I'm the Program Director of the Master Healthcare Management and the Master Zorgmanagement, both the same masters, but one in part-time and one in full-time, but I will tell you way more about that in the rest of my presentation. Just for the people who just arrived, please keep your videos off and mute yourself and keep your videos off because we are recording this presentation. But thanks again for joining us on this very last meeting and information session about these two masters. And I will ask you a little bit later on why you are perhaps still in doubt or hesitating about doing this master. But let me first tell you about this master. The presentation is going to be in English for two reasons. First of all, for potential international students who are here with us this evening, but also because we are recording it and we're going to put it on our website, so international students will need to understand this presentation. So that's why I'm speaking in English. But if you have any questions, you can put them in the chat, and please put them in Dutch if you want. I will answer them in English for you. Well, you're here, so probably you have some idea about what the master might entail, but perhaps, I hope not everything yet, because then I don't have anything to tell you. So why the Master Healthcare Management? And actually, this is really the perfect time to tell something about our Master Healthcare Management, because in this period, and of course I hope you're all doing well and feeling well, and your family is doing well, you have seen a lot on the news about healthcare, about organizing healthcare, about managing healthcare. And every day we see new articles in the newspapers about healthcare managers, healthcare directors, and how they, at this point in time, are trying to manage not only the COVID-19 virus, but also all the other people who are still ill and cannot go into either a nursing home or to the hospital because they are filled with people who might be ill or who are ill. So healthcare management is a huge challenge, as you can see these times. First of all, what we see is that patients and society, they want tailor-made quality of care. We do not accept anymore that if we are ill, that we don't get the care that we want and the care that we need. We see stories on the news at this point in time about people who are on a waiting list because the hospitals are full, or they do not want to have done some operations because of the COVID-19 virus. And many people don't find that acceptable. So a challenge for healthcare managers is to make quality of care that fits the patient's needs. But you can, of course, not only think about the patients. As a healthcare manager, you're also responsible for the health professionals, because they are, of course, also at the center of the healthcare system. And you are the one who needs to enable them to do their work and to be satisfied in doing their work. And that's not the only thing. As a healthcare manager, you're also working in the interplay between the government, patients, health professionals, and other organizations. And in doing so, you need to be accountable for your performance. You need to show that you're a good performer. Therefore, you need to be able to innovate in healthcare. Innovation is very important in healthcare. And again, you see that a lot these days. We see a big upcoming of all types of e-health in healthcare. It was always there, but it's becoming more, it's increasing, or substitution of care, because we cannot institutionalize certain people anymore. So healthcare is both a business and politics, and a real challenge, and it's the working place where, if you are going to do the Master of Healthcare Management, will be working in. So what is it exactly, Master Healthcare Management? Management, I'm sorry. The Master Healthcare Management will tell you through all types of theories, and by combining theories with real life cases in healthcare today, how you can be a good manager or policymaker or management assistant in healthcare. So you gain a lot of knowledge from various academic fields. But being a manager is not only about knowing a lot of theories. It is being able to apply these theories, and it's being able to work with people and to help people. So in this master, we also put a lot of emphasis on professional and personal skills that you need to deal with all the complexities that you are going to see and that you will have to manage. And during all of this, we have a main focus, and the main focus is our patients. The patients is at the center of the healthcare system. We want a good healthcare for our patients. So during the whole study, we put this patient at the center, its demands and needs. So if you aspire to be a critical thinking manager in the healthcare sector, then the Master Healthcare Management is something for you. As I said at the beginning, we have a full-time and a part-time master. The full-time master is called Healthcare Management, and this master is completely in English. Everything is in English. The classes, the working groups, the exams, the answers you have to give to the examination questions, all the assignments you have to make, and the thesis you have to write. It's completely in English. The full-time master is a 1-year master. Then we have the part-time master called Zorgmanagement. You get exactly the same courses, but you do them over a period of 2 years. So this master is very useful for people who are working and want to combine studying with work. Because the full-time master, there you're expected to study for 40 hours a week, and in the part-time master, it's 20 hours a week. Another difference is that the part-time master is partly in English and partly in Dutch. Which parts are in English? Those are the classes, and of course literature, and the examination questions. Those are in English. What is in Dutch? The working groups are in Dutch. If you have an exam, you can answer in Dutch, and your thesis is in Dutch. So partly English, partly Dutch. In all, both programs encompass 7 courses, 1 elective, a thesis, and if you want to, an internship or an exchange. And as I said before, we spend a lot of time on management and personal skills or professional skills to make sure that you're ready for the work you're going to do after this master. So what are the courses exactly, so that you have a good view and overview of what you will learn in this master? Well, as I just said, we put the patient at the center. So you start with a course called Patient-Centered Care. In this course, you learn how you can make healthcare organization, wherever you work, more patient-centered. How you can put the needs of the patient first and organize and manage all the healthcare around those needs. Another course is Advanced Research Methods, and the word is already saying it. It's a methodology course, so it's an advanced research course on your quantitative and qualitative skills. Then we go deeper into the different management disciplines, starting with organizational behavior, which is focused on human resource management. Being a manager is, as I said, extremely important to manage people. You need to know how to be a good leader. You need to know what type of behavior people have and how you can manage that behavior in order to get to the best performance in your organization as possible, but also to make all the health professionals happy. If you're not a good leader, they won't be happy. So of course, in human resource management. Another very important management discipline is quality management. And that's all about the quality and the safety in healthcare and the many challenges there are in how to do that. And again, if I can take this Corona period as an example, you see a lot of problems with having protective gears, having the mouth caps in healthcare, which are all needed to be safe and to provide quality of care. And you see how difficult it is to manage this quality. I continue with the example of the protective gear and the lack of it and the problems with it. That is mainly a logistical problem. It's not that they don't exist. It's sometimes very difficult to get them at the place they should be. It's like another example, the toilet paper. There wasn't anymore at Albert Heijn. And I think many of you have seen the funny video of the guy who works in a storage place and had all these toilet paper rolls around him and said, people, don't worry, we have enough. But how do you get them to the stores? So the next course is about logistical management or health service operation management, where you really learn how you can streamline your processes in a good way. Then, of course, financial management. Finances always play a very big role in organizations. Why? Because you need to be sustainable for the future, and you have either a budget or you get paid per performance, and with the money you have, you need to do everything that is needed. So in the course Financial Management, you learn about how you make decisions and you learn techniques to steer your organization, and all from the angle of finances. Then the last course is governance and strategy. As I just said, as a healthcare manager, you're really working in the interplay between the government, the patients, healthcare professionals, and within that whole interplay, you need to make decisions. Again, like the period we're living in now. And on my first slide, there was a picture of Rutte, and he decides things, and then organizations have to implement that. Or what they also sometimes do, they don't listen to it and do something else. But it's up to you to decide that. So the last course is really about strategic management, about governance, and how you should act as a manager in this interplay. For all these courses, you're allowed to do an elective. And we have 5 electives in the Master Healthcare Management. The first one, Healthcare Procurement and Value Chain Management, really looks at more the health insurance side of healthcare and how you can create value for your money. The second one, Health Service Innovation, is completely focused on how you can innovate in healthcare. So you really get a project, a real life case, and you will be asked to find an innovation for that. Then we have the elective Healthcare Ethics. Well, the word already says it. It's about how you can become a good ethical manager. Then we have a course which focuses on e-health and big data. And then we have a 5th one, and that's an internship. I will get back to that in a second. And lastly, a course of your choice. You are allowed in this master to follow a course at another university, at another faculty, in another country, as long as it fits the learning goals of the master. So it will always have to be accepted by the exam committee and by myself as a program director, but you have a choice. I'm sorry, I'm a little bit coughy today, not sick. I said the internship is one of the electives, but the internship is a bit of a special elective because the internship is more than just an elective. And that is because if you want to do an internship, we ask some extra investments from you because it is more hours of doing an internship than you get for it as an elective. Why do we do this? We do this because it's extremely important that you have some notion or feeling on what happens in a job that you might be working on in the future, that you really learn what healthcare is from the inside, that you learn what your potential job is. Many people who do the Master Zorgmanagement are already working in healthcare. So they know a lot already about how healthcare is working, but many students who come from a bachelor don't. And we see that a lot of students who have a bachelor degree do this internship. This year, for instance, we had 80 students doing an internship. So during this internship, you will be working in a future job. And you will be supervised by either a manager or a senior policy worker, but you will really be doing what you will have to do after you have finished the master. The duration depends a little bit on how you organize it yourself, but if you spread it over a period of 5 or 6 months, it's 2 to 3 days a week. If you do it as an elective, then of course it's a little bit less, because part of it will be done during the time that you're doing the elective. So you could be a full-time internshipper. And what is also important is that it's really an internship. It's not a job. So you don't get paid for it. And we think that is very important because if they would pay you, then they would treat you like a worker and you're somebody who's doing an internship and needs to learn. HCM, the Erasmus School of Health Policy and Management, I think many of you know, is actually the most renowned institute in the Netherlands when it comes to health policy and management in healthcare. Because of that, every year we get a huge amount of internship questions. So people who want to have one of our students as an internship. So there's a very, very wide variety of internships that you can do. Not only in a healthcare organization, but also for the government or the inspection or a health insurer. There's a wide variety in choice. As I also said, we put a lot of emphasis on the management and personal skills. We do that in the courses. We have a serious game, we have a dilemma game, we have a very short one-day internship, and we have also special courses who are really focused on a specific skill that you will need later on in your life, like negotiation, communication, leadership style, conflict management. We have loads of courses that you can follow. Finally, what you can do is go on an exchange. We have contract with different universities in Bologna, Innsbruck, Oslo. At this moment, I'm trying to get a contract with Kuopio in Finland. And there you can follow several courses as long as they are interchangeable with the courses that you would follow if you would stay in the Netherlands, or you can follow them as an elective. There is just a big but. The first but is that it always depends on the timetables of the universities abroad, if it fits with your own schedule. And right now, of course, we are facing the corona measures, so many borders are closed. So this is something that we don't know yet if it will be possible for you. It will really depend upon what is going to happen with this pandemic, if borders are opening again, if universities are opening their doors again. I really hope so for you. It's kind of sure that the first half year you won't be able to go abroad, but usually you don't want to because you really want to do the courses here first. And I hope that from January on, it will be possible again. But what does your agenda look like? Well, here you see the courses again, and I put a 1 and a 2 above. I'm pointing it, but you can of course not see what I'm pointing at. And that you need to see as year 1 and year 2 for the part-time master students. So the full-time master students do all these courses in 1 year. The part-time students do the courses in the second column in the first year and in the third column in the second year. That means that if you're a full-time student, you have courses on Tuesday, Thursday, and Friday. It's always like that. There are, of course, some exceptions, very small exceptions, but mainly it's only on Tuesday and Thursday and Friday. And on Tuesday and Thursday, you do the working groups, and on Friday, you do the plenary classes. So as you can see, if you want to do an internship, you have still a lot of time left to do so. If you are a part-time student, then you only come to the university on Friday because you only follow one course. So the whole course is given on one day on Friday. You first get a working group and then a class, or first a class and then a working group, but it will be a schedule that looks kind of like this. So if you're not working or if you want to do an internship, you can do that from Monday through Thursday. But of course, don't forget, you also need to study. It's not that you're free on Monday up until Thursday. You still will need to study, of course. What are the admission requirements for this master? Well, first of all, what is necessary is that you have a bachelor degree in one of the academic fields that fits the learning goals of this master. So it's a management, a bachelor in relates to relevant management and organizational sciences, or a bachelor in medicine. If you don't have that, then you need at least one course in healthcare management or healthcare organization. So we look at the whole palette of courses that you have done. If you've done a PreMaster, of course, you can be enrolled also. All applications will always be evaluated by an admission committee before admission is granted. That is because we really want to look well at what you have done to see if this master fits what you have done as an education before. Also for yourself, that is very important that you get into a master that fits the knowledge that you have. Then, I'm so sorry, I'm coughing. Then you also need to have a proficiency in mathematics. And if you do the full-time master, you need to have a proficiency in English. What the requirements are exactly, just read them on the website because there are quite a lot of them. But I can say that if you are from a bachelor from the Netherlands or an English-speaking country, then you are proficient in English. If you're not one of those students, then you need to do a test to show that you're proficient in English. And again, look at our website for the exact criteria and what you can do to become proficient in English. What if you're studying right now, you're doing a bachelor program, but you cannot finish it due to Corona? We have a soft cut, as we call it, and that means that you do not have to finish your bachelor to enroll in our master. So that's a big difference with other years, because usually you do have to have finished your bachelor, but because of the Corona measures, we make an exemption this year, you do not have to have finished your bachelor, but you need to have at least 162 EC. So if you have that, but no bachelor diploma, you can still enroll for this master. What about next year? What will it be like for you? We are pretty sure that we will start online. The way it looks right now, and if we see the measures the government is taking, even though they are becoming more flexible, they are starting with 30 people, maybe 100 people who can be together somewhere at the end of August, but still with 1.5 meter distance between them. Do realize that at the Erasmus University, we have almost 40,000 students. So we already know that it will be impossible for them to be all at the campus at the same time, and that we will start with all or part of the courses online. And we hope that it will phase into being on campus more and more, but we are sure that we will start most of the courses online. But the master will go through. No matter what, we can do it, we make it happen, as we say, both in Rotterdam and at the Erasmus University. So whatever happens, this master will start. What if you do not have a bachelor, or your prior education does not fit our admission requirements? Then you can do a PreMaster, our PreMaster, which is a deficiency program of 1 year. You need to spend 40 hours a week studying for it, but the courses are given on Friday and only on Friday, but from 9 o'clock in the morning up until 5 in the afternoon. So it's very full week and a very full day. And the aim is really to eliminate any deficiencies you have. And if you have your diploma from the PreMaster, you can do the Master Healthcare Management the year after that. So if you want more information about the PreMaster, please follow this link. And if you have any doubts about whether you can be admitted right away or not, just apply for the master and it will go, and we will look if you can be admitted or not, and you can see the website or the email address on this slide. These slides will be put on the website also, and on the website you can also find all these contact informations. What is your future like? Well, besides sitting again in a restaurant, close with each other, being able to do everything you want, this is your career perspective. The master is called Master Healthcare Management, and this is a question I get very often. Can you only become a manager with that? Because I don't want to become a manager, but I do want to work with topics that are related to human resource management or logistics or financial management. No, you can do a lot of other stuff with master. You can become a policy advisor or a consultant or a manager assistant. We see students in many different functions. It's more the topic that is at the center. But if you want to become a manager, then of course that is also a possibility. Do realize that, of course, after finishing this master, you will not immediately become the director of a hospital. That takes many years to get there, but you're more starting at a middle management level. At this moment in time, 85% of our students find a job within 2 months and 94% within 6 months. Usually around this time, students are already getting jobs, finding jobs, or they're being asked for a job. Also with the internship, 25% of the students who do an internship stay with that organization and get a job up there. So this is what the master is about. And this is a picture of a graduation ceremony. So that is something to work towards. If you want more information, we have our website. We have also a Facebook page. So please continue reading about this master if you need more information. But for now, what is more important is that if you have any questions, please ask them. This is the moment. You can type it in the chat function, and I will try to answer them as good as possible. The chat. I have a Bachelor in Business Administration. I see that many courses are quite similar to my bachelor courses. Therefore, I would like to know how much the courses focus on general management aspects and how much they focus on health-specific aspects, so I can decide whether this master will teach me enough new things. I think you actually touch upon exactly the difference between a general business administration bachelor and a master in healthcare management. That is the focus on healthcare. That is one thing. So yes, you will absolutely learn new things. Why will you also learn even more new things is that it is a master degree. So the basics of the different management disciplines that we just went through is something that is kind of an admission requirement. And we go a step further. We go a step deeper into theories and in using these theories. So it's that there will be overlap, I don't know, maybe a little bit, but for sure that you will learn a lot more because of the healthcare perspective and the broadening of your theoretical knowledge compared to the business administration. A question from Sakina. I have a bachelor in gezondheidswetenschappen, ISHPM. If you still need to do a math test, no. If you have done a bachelor degree, our bachelor, you're admitted directly. I can tell you, you're admitted directly. And it's no difference for the full-time or the part-time master. From Juan Sebastian Castillo. With current information, do you anticipate any problem or special need for overseas students to enter EU in time to master classes? Well, the biggest problem right now is that you will not be allowed to come, probably. That will all depend on the laws in your countries and the restrictions in your country and the ones in our country. So I can see by your name, it sounds a little bit Spanish, so you're either from Spain, Colombia, Costa Rica, somewhere like that country. So it will really depend upon the borders opening up. For the rest, there are no other special needs than before the Corona time. So depending upon the country where you're from, you will need a visa, and that's kind of it. Oh, I have to make this a little bit bigger because now it's going too fast. So I forgot Emma, and she's asking, is it necessary to have followed courses about health, biology, etc.? No. I can tell you no, because the focus is really on management and organization. So you do not need a healthcare background, but you do need some background in management and organization. Lisanne, what are the benefits of following this master if you're a medicine student and also want to complete your medical master? So you are a doctor and have followed this master. Yes, that is a question that I get very often from students who are also doing a degree in medicine. We actually have a whole lot of students who do medicine and also do this master. What the benefits are is that you learn about a completely different aspect of healthcare than what you are learning right now. You're learning to become a doctor, to work beside the bed of a patient or with patients. And with this master, you learn on how to manage healthcare. So the whole managing and organizing of healthcare, that is something that you learn, and not just medical stuff. So we see a lot of students who do this master because they really want to know more about the management and organization of healthcare. Some because they are already doctors for several years and they want to combine being a doctor with being a medical leader or a medical manager. So they do this master. And we also have students who just feel they need to know both sides of the coins to be a good doctor. So that are the benefits. Oh, Juan, you're from Colombia. Actually, I should have known that because you're from Bogota, right? Or not? Or am I now completely, yes, I saw your application. I actually went to Colombia many times, and I was going to Colombia on the 23rd of March, but very unfortunately for work, but very unfortunately due to the Corona crisis, your country wasn't closed up yet, but from the university they said that I was not allowed to go. And actually it was for the better because I had a flight back that went through Spain and Spain was closed. So I would still be in Colombia right now if I had gone, which would actually not be a bad thing. Imke, als je een master volgt, je weet je nog niet hebt afgerond. So if you have done a master while you haven't finished your bachelor, but you have those 162 EC, do you pay the fees, the tuition fees once or double? I don't know. I have the program director of the Master Heppel who is helping me out with this session.
Yeah,
do you know?
I don't know for 100%, but normally how you pay tuition fee only once. You're even allowed to do 3 masters at the same time, if that were practically possible, and you pay only once.
Okay, but it is a good question. But apparently only once.
Yeah, I don't see a reason why you should have to pay double.
No. I don't either. Sakina, how will the examinations be held during the Corona measures? Well, digitally. At this moment, we are doing digital exams. Sometimes, you know, an examination is writing an essay or a take-home exam. So there is no difference with the period before the Corona measures. But if it's really a written exam, then there is a difference, because instead of being in our big halls where you take the exams, you take them at home and make them at home. And you get a time slot in which you have to make the examination. From MB, how many days can you work besides the part-time master? Well, the part-time master, you need to study 20 hours a week. So the workload of the study is 20 hours. So it's completely up to you how much you want to have a life besides working and doing the master. If you say 36 up until 40 hours of work, then for 2 years you don't have a social life. And that's of course your own choice. So it's really up to you to decide what type of life you want and how much time you want to have for yourself. And based upon that, you can decide how many hours you want to work. The good thing about the part-time master is that it's only on Friday, so that people who work can work on Monday, Tuesday, Wednesday, and or Thursday. So that's why it's a part-time master. You can have a job next to it. Okay, that is a good question. I said for the part-time master that the education is always on Friday, and for the full-time master it's always on Tuesday, Thursday, and Fridays, with some exemptions. One of the exemptions are indeed the examinations. The examinations actually are never on Friday, or hardly ever on Friday, but they are always in the evening, always, because we want to customize our examination time for our part-time students. But it's not always on Friday, and it really depends on the course. It can be on Monday, Tuesday, Wednesday, or Thursday, really dependent on the course, but in the evening. From Rizvan, is it feasible to work 8 to 12 hours next to the full-time, in the full-time master? Well, I think it's a little bit the same as the question I had before about the part-time master. Yeah, in the full-time master, we expect you to study for 40 hours a week. So if you say 8 to 12 hours, you know, for me, that sounds feasible in the sense that if you still have a day in a week where you can kind of relax. So 8 to 12 hours, I think, yeah, is doable. But really do realize you really need to study also. So you're taking up a lot of workload upon you, but it is feasible. I'm not going to lie about that. It is feasible. Did I miss any questions?
There's another question.
There's another one. When do you hear about the acceptance of your admission? As soon as possible. That sounds really awful. There is a difference between being directly admitted and really having a broader admission board looking at your admission. So it's kind of a two-phase process. First, a very small group of people is looking at your admission because we do have some hard criteria that people can look at. If they match with your application, you hear it, I think, within a week. If it doesn't, then it goes to me, actually, together with our Director of Education. And we both look at your application real close to see if you will be admitted or not. So between that first phase and second phase, there is some time lapse. And that can be up to 2 or 3 weeks. But we always try to do it as quickly as possible.
Yeah. I think 2 or 3 weeks might be a little bit optimistic. It depends on how many people have applied in that period and when these applications are looked at. But usually it's within usually at least less than a month, and most of the times within 2 or 3 weeks.
Yeah. Okay. Thank you. Okay, from Sakina. I'm planning to work for 3.5 days next to my part-time study. Is it possible to do an internship next to that also? That's a very good question, and it's a very difficult one. Because if you work for 3.5 days a week, and then on Friday you need to follow your courses, so with traveling and all, you already spent 4.5 days. And then next to that, you also have to study, of course. Then it's very difficult to also do an internship. It's not impossible. I mean, I see students do things that I'm thinking, how do you do that? But if it is very difficult, and also because if you work for 3.5 days a week, and if that is during the week, you cannot do an internship at the same time. So if you work on Saturday and Sunday, then of course you have the rest of the week in which you can plan your internship. But if you work from Monday to Thursday, yeah, then it's impossible because you cannot be at 2 places at the same time. From unknown, how many students who follow this master each year? That's around 200. Sakina, so the internship period is parallel with another course. Yes, yes. The internship you plan yourself. So you have the courses, and if you do an internship, you plan when you do the internship with the organization where you are going to do the internship. The only moments where there is not another course, that is if you do it as an elective. So in the period where other students follow a course as an elective, you do your internship. So that's the only moment in time where there is not another course, with the exception of your thesis, because you're also writing your thesis in that period. Are there any more questions?
Maybe in addition to this, Isabelle, could you explain? It seemed like students have to find their internship themselves. Is that true?
No, they don't have to find their internship themselves. We have a huge database with internships because many organizations want our students to follow an internship. So at the beginning of the year, you have just an amazing choice of places where you can do an internship. If you found a place yourself where you want to do an internship, then it's up to the coordinator of the course to look if the internship you want fits our goals, and if that's the case, then you can do your internship at a place that you chose yourself. There is a maximum number of electives you can attend. No, actually you can do as many as you want. No, actually that's not true what I'm saying. If you do an elective, you can only choose one elective given by the healthcare management master. But if you want to do more electives at another faculty or abroad, then you are allowed to. I hope that answer is clear. So we ourselves have 4 courses that you can choose as an elective, and you can only choose one of them, and not 2 or 3. You can only choose one of them, but you are allowed to choose another course at another faculty and do that also as an elective at the same time. Any other questions? Do you have to write a thesis in the PreMaster? No, you don't. You don't have to. There isn't one. Of course, there is a lot of, there are many courses in methodology, and you do small research projects. You have to report on them, but there is not a thesis. How is the process to select a thesis topic? Okay, that's a good question. The process is as follows. In the Master HCM, we work with thesis groups. What that means is that you form, a supervisor is defining a topic, and you can enroll for that topic. And other students enroll for that topic. So together, of course, you all write your own thesis, but as a whole group, you are working on that specific topic. So selecting a thesis topic is selecting from the list of topics the supervisors provide you. And we have about 40 different thesis groups. So it really covers the whole range of the master, and also within a topic, very often you still can make a choice on what you want to do. Not always, but then you don't, if it's not what you would like to do, then don't enroll for that thesis topic. I have enrolled today for the part-time study. Am I still in time? Sakina, you're right in Dutch. So I suppose you're a Dutch student, and then the answer is yes. But if you do not live in the Netherlands, then you're still in time if you live in a country from the European Union. If you live in a country outside of the European Union, Bonaire, Curaçao, where they also speak Dutch, then the deadline has passed. Do you have to defend your thesis? Is a question from Rizwan. Yes. Yes, you have to defend your thesis. But it's fun. Don't worry. It's fun. It's a good ending of your career as a student. Any other question that I missed?
No, you didn't miss anything.
I didn't miss anything. That's good. So what are you guys, are you still very hesitant about doing this master? What is the reason that you're following this information session this evening? Can you tell me a little bit about that? So I know a little bit what my audience is of tonight, and maybe by knowing why you're still hesitating, I can tell you a little bit.
Starting in September or in 2021.
Okay, Laura is thinking about it because you also asked the question about the PreMaster. You're also looking at what you can do with a PreMaster. Very good. What about the others? Okay, I was still there, hesitating between full-time and part-time. Are you still hesitating, Deborah, or do you need anything? Do you need to know more about the difference, given your own circumstances? Just ask them. Sakina, I have a nice job as a researcher, and I was wondering if I could do that next to my master. Okay, yeah, that's a very good reason to join this session. Yeah. Emma, oh, you're looking for 2022. You first want to do a master in Nijmegen and then maybe the part-time master. Okay, that's interesting. And Deborah says, no, I think I will do the full-time master. All right. You know, Deborah, what is also a possibility, and many students do that, and it sounds a little bit strange, but they do the full-time master, but they do it in 2 years. So they kind of decide that they want to do the full-time one, but spread it over 2 years. Sometimes because it fits them better, or because friends are doing the full-time master, sometimes because it just happened to go that way, or sometimes because they want to do an internship and want to work next to it, and that is not possible in 1 year. Some because they want to go abroad for a little while. So that is also an option that you can think about. Unknown, still doubting whether to follow a master in a specific field such as accountancy or in an industry-specific field such as health for 2020. Yeah, that's a very difficult decision to make, but a very good one, because with this master, we really prepare you for healthcare, but as a generalist. So if you do a master in accountancy, yeah, that's really a different type of job that you will get. And you can become an accountant in healthcare, but with a master healthcare management, you cannot, for instance. So that's really something for you to think about, what you want to do after your master, what type of job you want. That will really have to be your main focus point. So I can understand your doubts. Okay, nice to see a little bit inside your reasoning and hesitations. And thank you, Elise, for being here. You're kind of, with your message, making a bridge for me, because I don't think there are any more questions. So I want to thank you all for being here this evening. And if you have any more questions, please, at our website or on these slides or on the video recording, you can find the email address where you can send your questions to. And most of all, I hope to see you. And even more than that, I hope you keep safe and healthy, as well as your family. So thank you very much for being here. And with those words, I'm ending these sessions. And I wish you a very good evening.